Many factors can increase your risk of developing breast cancer. Some, like genetics, can't be helped, right? Others, however, can be altered. Alcohol falls into that latter category. In fact, a new study shows that the link between breast cancer and drinking alcohol really needs to be made more obvious. In fact, a recent study estimates that drinking a bottle of wine has the same overall cancer risk as smoking 10 cigarettes a week. Researchers surveyed a group of women undergoing breast cancer screening or treatment and found that only 20% of them knew that alcohol is considered a risk factor, and only 49% of healthcare staff surveyed identified alcohol as a risk factor. Joining me now to discuss these statistics is Dr. Scot Ackerman of the Ackerman Cancer Center. Good morning to you. Thanks for being here. So we were talking about this, the whole bottle of wine equivalent to 10 cigarettes a week. And while 10 cigarettes a week for someone who has never smoked in their entire life seems like a lot, that's not that much considering that many people smoke more than one pack a day.
Right. Certainly, I'm not an advocate of tobacco use at all. But put things in perspective. A bottle of wine is the equivalent of half a pack a week. 10 cigarettes is only half a pack a week. If smokers only smoked half a pack a week, we wouldn't have this. We wouldn't have the issues we have with lung cancer and breast cancer and other cancers as well. We're concerned about people smoking. People smoke a pack a day. So I want to just put the brakes on a little bit. A bottle of wine a week is really okay. A bottle of wine a day is not. And that's what I want to talk about.
People would be watching, say, wait a minute, you're taking a bottle of wine? That doesn't seem like a whole lot over a 7-day period. Okay, so all right. Okay, you're not at increased risk then unless you're drinking a lot more. And let's talk a little bit then about what the risk is, because it's interesting. Alcohol consumption is a cause of 5% to 11% of all breast cancer cases, but this is a lot of alcohol.
Well, let's put the study first. The study is very interesting in that it looked at 200 women at this hospital in England, outside of London, and they questioned them about risk factors for breast cancer. And it turned out that only 20% of the women knew that alcohol had some sort of risk factor with breast cancer. It's a small study, and so you can be critical of that, but it's consistent with studies that have been done here in the States that have been sponsored by the American Cancer Society that have shown that about only 30% of women in America realize that alcohol is related to breast cancer. And also, as you said earlier, that only 49% of healthcare workers.
Even healthcare workers, you should know, right?
These healthcare workers involved in breast cancer, only half of healthcare workers realize that alcohol does factor into contributing to a woman's increased risk of breast cancer. So your question was, how much alcohol? And this 11% or 15% of breast cancer associated with alcohol. That's true. The breast cancers that we see, we can try to attribute certain risk factors to those. Many women don't have any risk factor. The risk factor might be genetic, but about 10 to 15% of breast cancers are related to alcohol consumption. And the amount we say is safe is a drink a day, because alcohol is okay. There are other health benefits of alcohol. It certainly reduces your risk of stroke, of coronary artery disease and cardiovascular disease. But once you get more than 2 or 3 drinks a day as a woman, it increases your risk of breast cancer. It also increases your risk for men and women of some other cancers as well, excessive drinking.
It's interesting because there's also, you noted when we spoke with you yesterday, that consider increasing your folate or your B vitamin intake. Now, that doesn't reverse the effects, obviously, of drinking alcohol, but can that kind of help deter breast cancer?
Well, it's good to have the right amount of vitamins in your system. Too much alcohol consumption can break down the liver function, and also that would affect your levels of these B vitamins. So certainly people that drink, we recommend they take vitamin B to counteract the effects that the liver would have on diminishing one's level of vitamin B.
And of course, we always want to remind our viewers, as we do every time you're here talking about specifically breast cancer, about health screenings. They are vital, to particularly depending upon your age, making sure you're having your yearly mammogram.
Right. We, again, recommend that women have their annual mammogram, their first mammogram between the ages of 40 and 45, maybe a little bit younger if they're high risk, like 35 or even 30 if you're high risk, which is family history of breast cancer, or if you're African American. And we also recommend that women know the risk factors. And one thing that I advocate, one thing that we do in our office, is when women come in for their first mammogram with us, we go through a little educational session with them, explain to them the risk factors. Because again, the first mammogram, that's a great step towards minimizing your chance of dying of breast cancer. So let's educate women about alcohol, about tobacco use, about obesity, about high-fat diets, and those things that all contribute to a woman's increased risk of breast cancer.
Dr. Scot Ackerman, thank you for being here. Do appreciate it. Always important information for the health of our viewers.